Most people assume serious heart damage announces itself with dramatic chest pain. In reality, some of the earliest warning signs can feel surprisingly ordinary. Getting winded on the stairs, needing an extra pillow at night, feeling unusually drained, or noticing your shoes suddenly seem tighter. Those symptoms can have many causes, and they do not automatically mean there is something wrong with your heart. This video is for general education only and cannot diagnose a medical condition. If you have new, severe, or rapidly worsening symptoms, especially chest pressure, severe shortness of breath, fainting, or other possible signs of a heart attack, seek emergency medical care. In the United States, that means calling 911. Your heart works quietly, around the clock, moving oxygen-rich blood through an enormous network of blood vessels. When the heart muscle, valves, electrical system, or coronary arteries are struggling, the body often compensates remarkably well at first. That is part of what makes heart problems easy to miss. You may simply slow down without realizing it. You take the elevator instead of the stairs. You stop carrying all the groceries in one trip. You blame the fatigue on age, poor sleep, or a stressful week. And sometimes that explanation is exactly right. But when a symptom is new, keeps returning, becomes progressively worse, or appears alongside other warning signs, it deserves attention. This matters because cardiovascular disease remains extraordinarily common. According to the Centers for Disease Control and Prevention, in 2023, cardiovascular disease was associated with more than 919,000 deaths in the United States. That works out to roughly one death every 34 seconds. Yet heart disease does not always begin with a medical emergency. Sometimes the body whispers long before it shouts. We are going to look at 9 signs that may appear when the heart is under strain or when blood flow is being compromised. And stay especially aware of the later signs, because one of the easiest to dismiss may appear nowhere near the chest at all. Chest pressure, tightness, or unusual discomfort. Heart-related chest symptoms are not always sharp, crushing pain. For many people, the sensation is more difficult to describe. It may feel like pressure, squeezing, heaviness, fullness, burning, or a weight sitting in the center of the chest. Some people simply say something feels wrong. When the coronary arteries cannot deliver enough oxygen-rich blood to the heart muscle, discomfort known as angina can occur. Angina is not a disease by itself. It is a symptom that may occur when the heart is not receiving the blood supply it needs. The sensation can sometimes appear during physical activity, emotional stress, or cold weather when the heart is working harder. Imagine a 68-year-old man named Robert who has always walked his dog around the same neighborhood. Recently, halfway up one particular hill, he begins noticing an uncomfortable pressure across his chest. When he stops walking, it fades. He assumes he is simply getting older. But a repeated pattern like that is worth discussing with a healthcare professional because predictable discomfort with exertion may be associated with reduced blood flow to the heart. Heart attack symptoms can also start gradually. They do not always arrive as the dramatic movie scene people expect. Discomfort may come and go, and some people experience only mild pressure at first. Chest pain can also come from muscles, the lungs, acid reflux, anxiety, and many other conditions. The important point is not to diagnose yourself based on the sensation alone. New or unexplained chest pressure should be taken seriously, particularly when it occurs with shortness of breath, sweating, nausea, lightheadedness, or discomfort spreading into the arm, back, neck, or jaw. Those combinations can represent a medical emergency. Shortness of breath that is new or getting worse. Breathing and heart function are closely connected. When the heart cannot pump effectively enough, pressure can build within the circulation and fluid may begin accumulating in or around the lungs. The result can be a feeling that you cannot quite get enough air. Sometimes this shows up during activity. A staircase you climbed comfortably 6 months ago suddenly leaves you stopping halfway. A short walk through a parking lot becomes exhausting. You find yourself breathing harder while doing chores that once barely registered as exercise. The change matters more than any particular level of fitness. Someone who has always become winded after running a mile is very different from someone who suddenly becomes breathless while walking from the bedroom to the kitchen. Another clue can appear when you lie down. Some people with heart failure find that breathing becomes more difficult when they are flat in bed. They begin sleeping with 2 or 3 pillows, or they move to a recliner because it simply feels easier to breathe upright. That does not automatically mean heart failure. Asthma, lung disease, anemia, infections, excess body weight, anxiety, and many other conditions can cause breathlessness. Still, a noticeable change in breathing deserves medical attention, especially when it occurs together with swelling, chest discomfort, fatigue, or rapid weight gain. And that brings us to a symptom that people often normalize for months before realizing something has changed. Unusual fatigue and loss of stamina. Everyone gets tired. Heart-related fatigue is different because it often represents a change from your normal capacity. You might notice that everyday activities suddenly require more effort, making the bed leaves you drained. You have to rest after showering. A grocery trip feels like a workout, or by mid-afternoon you are exhausted despite having slept reasonably well. When the heart is not pumping efficiently, the body may redirect blood toward organs it considers most essential. Muscles can receive less of the oxygen-rich blood they need during activity, which may contribute to weakness and reduced endurance. This can be especially easy to miss in older adults. Instead of saying, "I am short of breath," someone may simply stop doing things that make them breathless. Over several months, their world quietly becomes smaller. Consider Linda, age 72. She used to spend Saturday mornings gardening. Recently, she begins doing 10 minutes of work and then sitting on the porch because her legs feel heavy and she is overwhelmingly tired. She tells her daughter she is just slowing down. That may be true. But a clear decline from someone's usual stamina, particularly when it progresses, can be valuable information for a clinician. Fatigue by itself is extremely nonspecific. Poor sleep, depression, anemia, thyroid problems, infections, medications, and dozens of other issues can produce it. What makes it more concerning is the pattern: unexplained fatigue that is persistent, worsening, or occurring alongside other cardiovascular symptoms. A racing, pounding, fluttering, or irregular heartbeat. Most people notice an occasional skipped beat. You drink too much coffee, get startled, exercise hard, or lie in bed and suddenly become aware of your heartbeat. Brief palpitations are common and are not automatically dangerous, but persistent or recurring changes in heart rhythm deserve closer attention. An abnormal heart rhythm is called an arrhythmia. That simply means the heart is beating too quickly, too slowly, or irregularly. Some arrhythmias are harmless. Others can interfere with the heart's ability to pump blood effectively. People describe these sensations in remarkably different ways: a fluttering bird in the chest, a fish flipping around, a sudden thump followed by a pause, a rapid pounding that begins without warning. Some people feel the rhythm in their throat or neck rather than directly over the heart. The accompanying symptoms are important. If palpitations occur together with fainting, near-fainting chest pressure, significant breathlessness, unusual weakness, or severe dizziness, prompt medical evaluation becomes especially important. One common rhythm disorder is atrial fibrillation, in which the heart's upper chambers beat irregularly. Some people feel obvious fluttering. Others have fatigue or shortness of breath, and some have no noticeable symptoms at all. That illustrates an important theme in heart disease. The severity of a symptom does not always reveal the seriousness of the underlying problem. Dizziness, lightheadedness, or fainting. A brief dizzy spell can happen for completely ordinary reasons. You stand up too quickly, you have not eaten, you are dehydrated, a medication lowers your blood pressure. But unexplained fainting, repeated near fainting, or sudden lightheadedness can sometimes signal that the brain is temporarily receiving inadequate blood flow. The cause might involve an abnormal heart rhythm, a valve problem, changes in blood pressure, or another medical issue affecting circulation. The context helps doctors determine how concerning it may be. Suppose George, age 75, is walking from his kitchen to the living room when he suddenly feels as though the room is narrowing around him. He grabs a chair and the feeling passes within seconds. 2 days later, it happens again while he is walking outside. Repeated episodes like that should not simply be written off as getting older. Fainting during physical exertion is particularly important to evaluate. So is fainting associated with chest discomfort, palpitations, or shortness of breath? The heart's job is ultimately about circulation. When circulation becomes inadequate, the symptoms can show up in organs far from the heart itself. The next sign is a perfect example, because many people first notice it when they look down at their feet. Swelling in the feet, ankles, legs, or abdomen. If your socks suddenly leave deep rings around your ankles, your shoes feel tighter toward the end of the day, or your lower legs look unusually puffy, fluid retention may be involved. There are many possible reasons for swelling. Sitting for long periods, vein problems, kidney disease, liver disease, certain medications, and other conditions can all contribute. But swelling can also occur when the heart is not moving blood forward efficiently. When circulation slows, pressure can rise in the veins. Fluid may then leak into surrounding tissues, often settling in the ankles and lower legs because gravity pulls it downward. In some forms of heart failure, fluid can also accumulate in the abdomen. People sometimes notice another clue before the swelling becomes obvious. Their body weight rises unusually quickly. That does not necessarily represent body fat. Rapid changes over a short period can sometimes reflect retained fluid. The pattern matters. Swelling that repeatedly worsens as the day goes on, appears on both sides, or occurs together with breathlessness and declining exercise tolerance deserves attention. And while ankle swelling makes intuitive sense once you understand circulation, the next warning sign is easier to misread because the discomfort may appear several inches or even several feet away from the heart. Discomfort in the arm, shoulder, back, neck, jaw, or upper abdomen. Not every heart attack begins in the chest. Pain signals from the heart can sometimes be perceived elsewhere because nerves from different parts of the body share pathways as they travel toward the brain. This is called referred pain. In simple terms, the brain may have trouble identifying exactly where the distress signal started. A person may feel aching, pressure, heaviness, or discomfort in one or both arms. Others notice pain between the shoulder blades, pressure in the upper back, tightness in the neck, or aching in the jaw. Some people experience discomfort high in the abdomen and assume it is indigestion. This is one reason heart attack symptoms can be overlooked. Someone may be waiting for dramatic chest pain while the more noticeable symptom is nausea, unusual fatigue, jaw discomfort, or pain in the back or shoulder. Women can experience chest pain during a heart attack just as men can, but they may also report symptoms such as unusual tiredness, nausea, shortness of breath, upper back discomfort, or weakness. None of these symptoms proves that the heart is responsible. Jaw pain may come from the teeth. Shoulder pain may be muscular. Upper abdominal discomfort may come from the digestive system. What changes the picture is the combination, timing, and circumstances. New upper body discomfort that appears with exertion or occurs alongside chest pressure, shortness of breath, cold sweating, nausea, or lightheadedness should not be casually dismissed. A persistent cough, wheezing, or trouble breathing at night. A cough sounds like a lung problem, and very often it is. Allergies, respiratory infections, asthma, acid reflux, and many other conditions can cause coughing, but the heart and lungs share a very close relationship. When the left side of the heart struggles to move blood efficiently, pressure can build backward toward the lungs. Fluid congestion may contribute to coughing, wheezing, or a sensation of breathlessness. Some people notice that the problem is worse at night. They fall asleep normally, then wake suddenly feeling short of breath and need to sit upright or stand near a window until breathing becomes easier. Others gradually begin using more pillows without consciously thinking about why. This nighttime pattern can be medically important. A persistent cough by itself should never be labeled a heart symptom without proper evaluation. But when it appears together with swollen ankles, reduced stamina, rapid weight changes, or difficulty breathing while lying flat, the overall pattern becomes more informative. The body rarely organizes symptoms according to medical textbook chapters. Heart problems can affect breathing. Lung problems can strain the heart. Kidney function can influence fluid levels. Medications can change blood pressure and heart rhythm. That is why clinicians look at the whole picture rather than one isolated symptom. And the final sign may be the most unexpected, particularly in older adults, because it can initially look as though nothing cardiovascular is happening at all. Sudden confusion, unusual weakness, or a noticeable change in alertness. When people think about heart problems, they usually think about the chest. But the brain depends on a constant supply of oxygen-rich blood, and significant changes in circulation can sometimes affect mental clarity. In older adults, serious illness does not always present in the textbook way. Instead of obvious shortness of breath, an older person with worsening heart failure may become unusually tired, weak, sleepy, or confused. Imagine 80-year-old Margaret, who normally manages her morning routine independently. Over several days, her son notices that she is moving much more slowly, seems unusually drowsy, and becomes confused about appointments she normally remembers. At the same time, she has developed ankle swelling and becomes winded walking across the house. Confusion has many possible causes, including infections, dehydration, medication effects, metabolic problems, neurological conditions, and emergencies such as stroke. It should never be assumed to come from the heart, but a sudden or substantial change in alertness, particularly when it appears with breathing difficulty, fainting, chest symptoms, or major weakness, warrants prompt medical attention. And if someone suddenly develops facial drooping, weakness or numbness on one side, difficulty speaking, severe trouble walking, or other possible signs of stroke, emergency evaluation is critical. In the United States, call 911. The larger lesson behind all 9 signs is not that every unusual sensation means heart damage. Most of these symptoms have multiple possible explanations. The lesson is to notice change. Your body has a baseline. You know roughly how far you can walk, how you normally breathe on the stairs, how much energy you have in the afternoon, whether your ankles usually swell, and what your heartbeat normally feels like. A meaningful departure from that baseline, especially when it persists or progresses, can be useful information. It can also help to think in patterns rather than isolated symptoms. Mild ankle swelling after a long airplane flight is one thing. New ankle swelling combined with breathlessness when lying down and a sharp decline in stamina is a different pattern entirely. Occasional lightheadedness after standing quickly is different from nearly fainting during a walk while your heart is racing. And urgency matters. Gradually declining exercise tolerance may justify making an appointment with a healthcare professional. Sudden chest pressure, severe shortness of breath, fainting, or symptoms suggestive of a heart attack require a different response. If you believe you or someone around you may be experiencing a heart attack, do not wait for every classic symptom to appear. Emergency medical services can begin evaluation and treatment before the person reaches the hospital. In the United States, call 911. It is also worth remembering that heart disease can sometimes exist without noticeable warning signs. High blood pressure and coronary artery disease may remain silent for years. Symptoms are only one piece of cardiovascular health, which is why routine medical care and conversations about personal risk factors remain important. So remember what we have covered: unexplained chest pressure, worsening shortness of breath, declining stamina, abnormal heart rhythms, dizziness or fainting, swelling, discomfort that travels beyond the chest, persistent nighttime breathing problems, and sudden changes in weakness or alertness. None of these symptoms should be used to diagnose yourself, but none should automatically be dismissed when they are new, unexplained, recurring, or becoming worse. And the scale of the problem is worth repeating. In 2023, more than 919,000 people in the United States died from cardiovascular disease. That is approximately one cardiovascular death every 34 seconds. The encouraging part is that paying attention does not require becoming afraid of every ache or heartbeat. It means knowing you're normal, recognizing meaningful changes, and getting appropriate medical guidance when something does not feel right. Think about your own experience or that of someone you care about. Which of these warning signs do you think people are most likely to brush off as ordinary aging, stress, or being out of shape? Share your thoughts in the comments. Your perspective may help someone else recognize a pattern they had not considered. And if you know someone who would benefit from understanding these quieter cardiovascular warning signs, consider sharing this video with them. Subscribe if you would like more clear, evidence-based medical education explained without unnecessary fear or complicated language. The goal is simple: understand your body better, ask better questions, and know when a change deserves attention.